Hello, everyone, and welcome. This is Michaela Conley, HP CareerNet, Health Promotion Live, State of Wellness. Let me remind you that, as I said, this is being recorded and will be available later this afternoon. Kelly has already put a coupon code in the chat box, so if you want to use that to purchase continuing education, that's totally up to you. Either way, it's all good, but it's worth 25% off. And if you have questions during the webinar, please type them into the chat box, and we will get through as many of them as we possibly can before Ron heads off into the very warm sunset to have a nice weekend. So, Kelly, would you like to introduce Ron?
Yes, I would. Today we have Dr. Ron Goetzel. Dr. Goetzel wears two primary hats, including Senior Scientist and Director of the Institute for Health and Productivity Studies at Johns Hopkins University, Bloomberg School of Public Health, and Vice President of Consulting and Applied Research for Truven Health Analytics. Dr. Goetzel serves as task force member of the Guide to Community Preventive Services housed at CDC and president and CEO of the Health Project, which annually recognizes organizations with the prestigious C. Everett Koop Award. He is also a member of the Institute of Medicine's Committee on Department of Homeland Security Workforce Resilience. He's a nationally recognized and widely published expert in health and productivity management, return on investment, program evaluation, and outcomes research. And we're pleased to have him back today. Dr. Goetzel?
Well, thank you, Kelly, and thank you, Michaela. Really appreciate the opportunity to present this afternoon or morning, depending upon your time zone. So this presentation is entitled, What Makes for a Healthy Workplace? And I've spent most of my career doing measurement and evaluation of workplace health promotion programs. And in the course of time, obviously, you get insights and peeks into what makes for effective programs versus those that are not effective. There are programs that we've evaluated that have had remarkable results, and we published on many of those programs, but we've also had programs that were not that terrific. And so throughout this process, we've learned more or less by hit and miss as to what works and what doesn't. But what I'll describe today is a formalized project that we are in the middle of right now that's supported by the Robert Wood Johnson Foundation that is a much more rigorous review of what are the key elements, the secret sauce that contributes to effective programs. And so what problem are we trying to solve here? Well, the problem that we are solving is that poor health costs money. Not only is it poor in terms of personal health and population health and quality of life, it actually has a severe drag on the economy, as noted in terms of increased medical costs and a spillover effect into absenteeism and work loss, safety issues, workers' comp claims, presenteeism, which is on-the-job productivity related losses, and the risk factors that contribute to all of the above. So in our work, we have done a lot of financial analyses. This is an example of one where we looked at our very large market scan normative database that's housed at Truven Health Analytics. It basically is an accumulation of all the medical claims data from a lot of large corporations who work with us. And in this study, what we looked at was what were the most expensive health conditions that employers face on a per capita basis, not on a condition by condition basis, but really across the entire population. And as you can see, if you go from the bottom up, we're looking at angina, at hypertension, at diabetes, mechanical low back pain disorders, AMI, heart attacks, COPD, and all of these have an attribution that's associated with behavior and lifestyle. In fact, what this chart shows is it's not just the direct medical costs, but it's also the indirect costs that are that you pay for in terms of increased absence and disability. So if you flip things around, instead of looking at the consequences, the diseases, the ICD-9 codes, and you look at the root causes, you can see them listed here, anywhere from obesity, tobacco use, lack of exercise, poor nutrition, and so forth, and all the various consequences of having that risk factor, which are manifested in the medical claims record as a claim, as an ICD-9 code. But again, you can track it back in many, many cases to the behavior or lifestyle factor. And if you pan out even further, if you begin to bring in this notion of presenteeism, what is presenteeism? Presenteeism is essentially being physically at work, but because a certain health problem that you have, which is not being well managed, it's actually preventing you from being at an optimal performance. So if you have hypertension that's out of control, if you have depression, if you have allergies that are not being managed, all of these different problems that you may have, they're not being managed. They are contributing to some portion of time lost during the day because you're not at your peak performance, and that too can be monetized. And you can see for these conditions shown here, the purple represents a lost presenteeism associated with these conditions. We've done a lot of research where we have connected individual claims data and health risk data, and then beyond that, looking at absenteeism and presenteeism. This is an example of a study we did with Mayo Clinic, which looked at 11 risk factors for a very large employer. And the ends here range from about 32,000 people to about 158,000 people, where again, we're able to connect their health risk data back to medical data, to absence, to presenteeism. And I don't expect you to read this, although all of this will be available afterwards. But in each category, when people had high blood pressure, high blood glucose, high cholesterol, high triglycerides, obesity, emotional health, the 11 risk factors that are typically assessed in a health assessment, people with those conditions, those risk factors, had a higher proportion of costs associated with all of these different financial outcomes. Another illustrative study was one we did with PepsiCo. This was with mostly their truck drivers, mostly males in their upper 40s, and looked at all the risk factors, but then connected it back to financial measures. This is just one example where we looked at overweight and obesity and looked at people who were overweight and obese, and that's about 75% of the population, 74, 75% of the population. And as you move up the scale here from normal weight to overweight to 3 classes of obesity, you can see that the costs are rising. They're rising in terms of medical costs, short-term disability, workers' comp, presenteeism, absenteeism, and if you add them all together, that's about a 25% differential between people who are normal weight versus overweight or obese, and that's about $1,000 difference in the analysis that was done a few years ago. So again, there's no mystery here that if you look at risk factors and alongside of these risk factors, you look at the disease outcomes, there is a correlation. This is just a CDC map that looks at the prevalence of obesity 1990, 96, and 2006, and you can see obviously new colors have been introduced and higher rates of obesity are being found in many states, and even Colorado, which is now shown in blue here in 06, no longer has obesity rate that's better than 25%. In fact, it's down to lower than 20% of the population is obese, and everybody else is overweight or obese. And then also, correspondingly, you can see the prevalence of diabetes. So again, those states that have the highest obesity rates are also the ones that have the highest prevalence for diabetes. Now, this is an interesting study we did with Vanderbilt University employees. Lori Rolando is the lead author on this study. She's a physician at Vanderbilt University. They've been collecting data on their workers for over 10 years now. And what they're able to do is on an annual basis chart the risk profile of the population and look at other things in connection to that. So actually there are cohorts that are being followed, kind of like a Framingham cohort, and then also individual pictures or snapshots in time of their population. This study in particular was interested in the idea of this link between obesity and diabetes. And so we looked at the cohort of people who had data for all 8 years. We looked at their obesity prevalence in year 1, whether they remained obese in years 2 to 4, and then in years 5 to 8, we looked at whether they developed diabetes or not. So let me walk you through this chart. The people who were obese at the beginning, remained obese, 10% of them developed diabetes in the out years, years 5 to 8. But the people who started obese and then moved to non-obese status, only 2.4% of that population developed diabetes. People who were healthy throughout, 1.2% developed diabetes. And those who started from non-obese but became obese, unfortunately, their incidence of diabetes was almost as high as those people who were obese the entire time horizon. So this is an example of a real-life, real-world application of what we know about in terms of the diabetes prevention program, where you can actually, if you are able to shift the risk profile, in this case, overweight and obesity in the population, that can actually have a direct effect on diabetes incidence, and this is over an 8-year time horizon. So if you take all of these together, there are increased health and productivity risks within a population. In fact, close to 100% of the population has at least one risk factor, but they manifest these risk factors in terms of medical consequences, psychological disorders, behavioral risk factors, and important for a company, organizational outcomes. That is, increased absence, poor work relations, high turnover, low morale, job dissatisfaction, and overall impact on productivity and the performance of the enterprise. So, bottom line, the vast majority of chronic diseases can be prevented or better managed. The CDC estimates that 80% of heart disease and stroke, 80% of type 2 diabetes, 40% of cancers could be prevented if Americans were only to do 3 simple things. Just stop smoking, start eating healthy, and get in shape. Easy to do. Well, we know it's easy to do, but it's hard to do. However, one of the areas that is least leveraged in terms of population health is the workplace. And the workplace is actually where we spend most of our time, most of our waking hours, at least on weekdays. There are about 156 million people who go to work every day, and they spend typically 8, 9, 10 hours at work, and sometimes that spills over into the evening and the weekends. So it's a unique opportunity for employers to improve population health. Population health is most often thought about in terms of health departments, but really where people spend most of their time is at work, at least adults do. And there's about 30 years of research out there that says the benefits of workplace health promotion programs is that they improve employee health and well-being, they decrease healthcare costs, and they increase worker productivity and performance. But there's still a challenge out there. Employers they're skeptical. They're not convinced of the health and economic benefits of these programs. They're unsure about where or how to begin these programs. And they're also unable to discern about what works and what does not. So they're looking for guidance. They're looking for a cookbook in some ways to help them start and sustain good evidence-based health promotion programs, because they're often bombarded with a lot of this negative press that these programs don't work. I'm sure you've seen some of these headlines. Wellness program scams cost employers and harm employees. Worker wellness plans best for businesses, but not necessarily for workers. Popular, but unproven. And do these workplace wellness programs work? This is from the New York Times. Usually not, is the conclusion of that headline. And wellness gone wrong. So there's a lot of negative press out there, a lot of media attention about these programs. And the reality is that some programs work very, very well, and other programs actually don't work very well. In fact, and some of them are actually harmful to workers. So what is the evidence base to support that these programs have the potential to improve the health and well-being of the population? Well, we know that there's a large proportion of diseases and disorders that's preventable, and that modifiable risk factors are precursors to large numbers of diseases and disorders and premature death. There's tons and tons, tens of thousands of epidemiological studies making that connection between behavior and poor outcomes. Where it gets interesting for the employer community is that many of these modifiable health risk factors are associated with increased healthcare costs and reduced productivity within a relatively short time horizon, within 1 to 3 years. And there's evidence out there that these modifiable risk factors can be improved through best practice and promising practice health promotion programs. If you improve the risk profile of the population, that would lead to reductions in costs. And there's even evidence out there that some of these programs provide a positive return on investment. There's a positive cost-benefit ratio, meaning you spend $1, but you get sometimes more than $1 back in terms of your investment over a 3 to 5 year time horizon. So the evidence that these programs work, there's systematic review done by the community guide that's housed at the CDC. This is a series of articles that were published in 2010. In fact, the main article for those interested was February 2010 in the American Journal of Preventive Medicine, where 86 studies were reviewed. And the conclusion of this systematic review was that these programs can have a positive impact on behavioral risk factors, biometric risk factors, and overall health risks of the population, as well as healthcare utilization and workforce productivity. So both a health analysis as well as an economic analysis. Another economic analysis published in Health Affairs by 3 Harvard economists, Baker, Cutler, and Song, came up with the headline that these programs can generate savings. And they looked at the studies dating back about 20 or 30 years, did a meta-analysis of those studies, and then came up with some estimates of what the return on investment might be, both in terms of medical costs as well as absenteeism. We recently, back in September of 2014, published an article which was entitled, "Do Workplace Health Promotion Programs Work?" We didn't have the tagline, "Usually not," because we said it depends. Depends upon whether they're well-structured, well-designed, well-implemented, and well-evaluated. But this was a very thorough review of this controversy, including a discussion on some of the studies that have been recently been published, as well as disseminated through public media, that potentially say that these programs don't work. And we reviewed some of those studies and looked at them with an objective point of view. One other study that's, I think, really interesting, and this type of analysis is actually being replicated right now, but let me describe what this is about. Ray Fabius, who is the former Chief Medical Officer at Truven Health and now the President and CEO of HealthNext, he and several other co-authors were interested in finding out what would happen if you invested in companies that really valued health and safety of their workers. If you invested in the stock market in those companies, what would their performance be compared to the S&P 500, the Standard & Poor's 500? Well, here's some of the analyses they came up with. First of all, on the left, table 2, you see the list of award winners, and these are many large companies. Many are obviously recognizable names like Lockheed Martin and Boeing and IBM and Johnson & Johnson and Glaxo and a few others, Dow Chemical, that have had a long history of attending to the health and safety of their workers. And so as these companies won the award, their stock was purchased, virtually, not actually, but virtually, and compared, their performance was compared to the S&P 500. And in this scenario, $10,000 invested in 1999 would have produced close to $18,000 in value by the year 2012, compared to really no meaningful change in the S&P 500. And another way of looking at the data, this one including outliers, showed that there was probably kind of a 2-to-1 return. So whereas the S&P 500 basically broke even, 10,000 invested in the baseline gave you 10,000 back. If you invested in these companies, you'd actually get $20,000 back. So the question that we all face and what we're investigating as part of this project is, do these programs work or not? And the answer is yes, if you do it right. So for example, this is a simile that Ina Chung Raymer, who's Deputy Director of the Institute for Health and Productivity Study, came up with. You know, you can be going out there buying a car, and it's got 4 wheels and a body, and it'll, you know, probably bounce around. But what you really want is a nice design, and obviously a safe design, and aerodynamic design. You want a car that's fuel efficient. I just recently bought a hybrid, so I'm very much into fuel efficiency. You want the electronics and the technology to be state-of-the-art and very effective. And you want all of the cylinders to be firing together. So the metaphor here, you've got to have the leaders, the managers, the employees, the champions, everybody on the same page and moving in the same direction towards a common goal for your car to be effective and for your program to be effective. So the answer is a healthy workplace. And what that means is balancing the needs of the organization with the needs of the employee. So it's give and take scenario for these programs to be effective. That was a genesis of our Promoting Healthy Workplaces project, which is supported by the Robert Wood Johnson Foundation. Here are our aims and objectives. Primarily, it's to fill the knowledge gap about what constitutes an effective health promotion, or in some cases we call it wellness program. Identify how organizations are succeeding when they implement these programs. And then, most importantly, share the ingredients of their secret sauce with the business community, but do it in a way that's not overly academic and dense, but tell stories. Tell stories about these programs and their companies stories are backed with substance to inspire more companies to start or improve health promotion programs at their worksite. So essentially, this is a way of disseminating knowledge, best practices, promising practices to audiences that by and large don't know how to do it well. So the approach that we used in taking on this project is we have updated our literature review. We did a literature review published in 2007 in the Journal of Occupational Environmental Medicine. That was a project funded by the CDC. But we went back and looked at other literature and new advances in the field of health promotion to see what is out there and what are some of the best minds thinking about in terms of what constitutes effective programs, and also the evidence base to support those kinds of conclusions. But we did two other things. First, we assembled an expert roundtable. So we brought together a lot of really, really smart people, people who know this field, who have worked in it for many, many years. And we basically challenged them to give us advice, give us direction, give us tactical and very down to the ground advice, support and advice and direction as to how to run these types of programs, how to design, implement, and evaluate them. We also decided to have site visits to 9 companies. And the selection process that we used in determining which 9 companies to visit, first of all, we went to those companies that have won the C. Everett Koop Award. Those are listed on the healthproject.com website. These are companies that not only sound like they have good programs, but have data to support their investments, data that show that their programs have improved health and saved money. So that was a first place for us to begin to look for potential clients, companies, but we also wanted to have a diversity of companies. We wanted to have companies in different industries, different parts of the country, and also some smaller companies. In fact, one company was 500 employees big, because we wanted to show that this can be done not only in huge, big Fortune 50 companies, but also very small mom and pop type of companies if it's done well. So we wanted to have a good program mix, and the expert panel that we convened to advise us on best practices and promising practices is shown here. And these were also the people we called upon to say, well, who's out there with a great program that actually is an effective program? And they gave us a lot of ideas and recommendations and suggestions as to who we might visit. This was a list of 9 companies that we did end up visiting, site visits. We spent a day with them. We spent a lot of time talking to the senior managers, senior officials of the company, middle managers, employees themselves, the program implementers. And we even went back with a camera crew and visited 3 of these companies again to get kind of a first-hand view of what they're doing and to document with video some of their programs, and also some of their officials and executives as well as employees telling us why they think the program is effective. So you can see there's a potpourri of companies that are on the list. Some are manufacturing companies, some are in e-commerce. The smallest company actually is this Next Jump company with just 200 employees. Turk has 500 employees, Graco with 1,000 employees, and then we go all the way up to Johnson & Johnson and Citibank and Dell Computer and a few others that are quite large and multinational companies. So it's really quite an array of companies that have done a great job. So, the moment you've been waiting for, what is the secret sauce? How do these companies achieve great outcomes? So we've come up with our top 10 lists, and I'll walk you through some of those magic ingredients, starting with a culture of health, which in many ways is hard to define, but it's palpable. You know, when you walk into a company, you really feel that the company really cares about the health and well-being of its workers. And it's not just kind of the direct health and well-being, but it's really a climate of trust, of engagement, of one where there's a sense of fairness, where people have autonomy, where the job demands are reasonable upon them. There's a lot of camaraderie there. People really like being at work, actually. But it's all embedded within this big culture that they have. And so it's much more than just a program. It's a way of life that permeates all the aspects of the organization, from its business mission, its built environment, and then the way in which workers interact with one another. It's part of their identity. And for example, at Lincoln Industries, this culture starts in the hiring process. So when they look for employees to work at Lincoln Industries, they first ask whether the employee understands and believes and would accept the company belief and culture before they get into the skills and talents they may bring. Because they say you can always teach people how to do stuff, but you can't really change the way they think or their attitudes or the way that they view life. And so they're looking for a certain type of employee, people who like working with other people, are open to ideas, and then they say, well, all right, can you do the job that we're asking you to do? And in fact, in their performance evaluations, their managers and the employees are expected to include a health promotion wellness goal for themselves and also for their teams as part of their performance review. So first thing is they care about people. Second important variable, and this goes hand in hand with culture, is leadership commitment. So these programs are often CEO driven, but if you go down to the bottom of this list, they are empowered by workers and unions. So it's really a labor management type of collaboration to make these programs effective. But the important part here is that leaders are there, they're verbal, they're visible, they lead by example. They also have middle management support, so it's not just the CEO, but it's the supervisors and middle managers that believe in the program and support it. There's budgets for this program, there's business plans, and again, there's a sense of the workers and management are in it all together. And there are terrific examples of this. So for example, back to Lincoln Industries, the evaluations that they have, one item that they have to rate themselves on and their workers on is wellness and healthy lifestyles are important to our success. So that's part of their performance review, and even bonuses are tied to that kind of performance review. The third magic ingredient, specific goals and expectations. So making sure that when people start a program and continue the program, that everybody's on the same page in terms of what they expect the program to achieve and by when. So one thing that we heard is think big, but start small and act fast. So do things one step at a time, but kind of build on your success. So do a lot of piloting of programs, but have a big picture view, but keep adding to the program incrementally. Set short and long-term objectives, be realistic about what can be achieved, and you can see here we're talking about 1, 3, 5, and 10+ years of expectations and goal setting. And importantly, there's accountability built in. So it's not just, if you get around to doing it, but these expectations are written down, and leaders and employees are held accountable for doing their part in supporting a culture of health. Number 4, strategic communication. Relentless, surround sound. That was the expression that was used by Peter Wald, the medical director at USAA. You're constantly surrounded by messages that are supporting a healthy lifestyle. So the messages need to be consistent, constant, engaging, targeted, and there's a two-way dialogue using a variety of channels. So people are able to give feedback saying, this really doesn't work for me, or this is a great idea, I want to bring other people in, or have you thought about including this group or doing it this way and that way. And importantly, the wellness champions or ambassadors are part of that communication channel, because people are much more likely to listen to their coworkers than any kind of anonymous email that comes out of the blue. So having people do one-to-one recruitment and engagement and encouragement is really, really important. This ongoing communication that is so important in different methods. And by the way, in terms of tailoring, obviously making sure that it's communicable, the right level of literacy, the right languages, the right audiences, the right topics. The more tailored, the better. Number 5, I keep coming back to this idea of employee engagement in program design and implementation. This can't be a top-down program. It's got to be grassroots and something that's supported by senior management. This is the CEO of Turk Industries, fishing for ideas. So people are there constantly providing feedback and input as to how the program should be run. There are wellness committees, there are feedback surveys. From a public health standpoint, this is referred to participatory-based program design. and focus groups. And there's a constant need to generate information about the program, what's working, what's not working, what needs to be fine-tuned. And in each of our discussions with these companies, we always ask the question, what did you try that failed miserably? You know, what were some of the things that really didn't work? And in every one of our conversations, people were very forthright in telling us, we tried this idea, it was a failure. People didn't like it, didn't participate, thought it was a bad idea, we got rid of it. But they would not have known about that had they not asked. And they keep asking, and it's kind of this ongoing feedback loop that that moves the organization towards a quality improvement process. Best practice interventions. Well, a few things here. First of all, you want to make things convenient. You want to remove barriers. It's kind of the ergonomics of health promotion. You want to remove anything that can stand in the way of you being healthy, and where the healthy choice is the right choice, the easy choice to make. Many choices also. People really have different preferences, different things that they're excited about doing, and applying behavior change theory in practice. You know, there's actually a very large science out there developed over the years by Vic Straker, Albert Bandura, Kate Lohr, Jim Prochaska, just to name a few people, who've given us a lot of science, a lot of very practical ideas about how to get populations to improve their health, how to nudge them in a certain direction. And that kind of science, that kind of behavioral theory and application is being used by the people in these companies because they really try to stay on top of the science. So they attend conferences, they attend think tanks, they read literature, in some cases they even publish their own studies. So they want to make sure that they're on top of what is current and what's relevant in terms of behavior change at the population level. 7, effective screening and triage. And this is one area that has actually come into a lot of controversy because a lot of companies are now thinking that a health promotion program is just taking an HRA, doing a biometric screening, and then giving you money if you achieve certain levels. But that's not it. This is obviously one of several different avenues of getting people to improve their health. And people do want to know what their numbers are. They want to know about their biometrics. They're actually interested in seeing their health improve over time using objective measures. But that's not the only thing. So if you just do a health risk assessment, and even with some follow-up, whether it's digital follow-up or verbal follow-up, it's not enough. You've got to add the plus. And the plus is all of the other programs that surround the HRA, which is a good cornerstone for any program, but it is not the end-all, be-all. The biometric screenings that are given, we recommend that companies follow U.S. Preventive Services Task Force guidelines. If you're looking for those, they are found in the Agency for Healthcare Research and Quality, AHRQ. There's a website there for the U.S. Preventive Services Task Force. Those are the guidelines that should be applied in doing biometric screening. And then oftentimes these companies have on-site clinics and counselors to help people understand and interpret their measures and also to take action steps. Number 8, incentives. But note that I put the word smart incentives in front of that. So there are a lot of dumb incentive programs out there, and they've been in the headlines. I won't name names, but you know who they are. Where the incentive is the program. Basically, I'm going to pay you money to be healthy, and people, appropriately so, are suspicious of that kind of potential bribery that's being offered. Why are you paying me to do something? What are you going to do with the data? How are you going to use it? Is this going to get to my supervisor? Am I going to get fired if I get bad biometric measures? You know, should I lie on this, and so forth and so on. So those are not the kinds of incentive programs that we found and recommend. Smart incentives are those that are tailored and provide alternative paths to motivate, reward, and help employees achieve their goals. So all the companies we visited actually had incentive programs in place, but they were well accepted and integrated into the culture of the company. In fact, one of the first incentive programs out there is at Johnson & Johnson. I was there at Johnson & Johnson in the mid-90s when they introduced a $500 incentive to participate in the program, and it was very well received. In fact, they had about 90 to 95% participation rate in the program because people wanted to get their $500 credit. But once they were in the program, they were able to take steps to improve their health and well-being. And that program is still in place today. It's being fine-tuned along the way, but really the basic architecture, the structure of the program is the same as it was 20 years ago in 1995. And all of the other examples that companies that presented to us were terrific examples. In fact, one of the ideas, which is a great idea from USAA, is tiered incentives, where basically you pay people, you reward people who are already healthy, and also acknowledge people who are moving in the direction of being healthy. So they get rewarded for attempts, for moving towards the goal, as well as people who achieve certain goals. So everyone wins in that kind of situation. If you're healthy, you get rewarded. If you're moving towards improved health, you get rewarded. If you achieve improved health, you get rewarded. And it's a system that actually is easy to understand, easy to track, and very well accepted by the population. Also, importantly, many non-monetary incentives, including recognition programs, are highlighted. Everyone we talked to cautioned us about using sticks or penalties. They all have carrots or rewards for leading healthy lifestyles, presented in a credible way. All of these are voluntary, so they don't have reasonable dollar amounts associated with them, something that makes sense, gets your attention, but is not overwhelming and compelling and coercive in nature. And in many cases, the incentives are presented in terms of a long-term view. In other words, you want to save for your retirement. You want to live a long, healthy life even after you retire from this company. In some cases, they offered pensions. So why don't you store up all this money so that when you're 25, 30 years of retirement, you'll have plenty of money and you'll have your health. Number 9, effective implementation, again, tailored to the company's culture. Each of these programs was very unique because it was adaptive to the kind of environment that this company had, whether it was manufacturing, communication, young engineers, older factory workers, people in call centers, different kinds of environments, different kinds of structuring and tailoring that was needed for these various companies. Integrated solutions so that if you have emotional health, mental health problem, you're here, but you're not in a separate silo from the health promotion program or occupational health and safety program. They are integrated in this broad umbrella of total worker health that includes occupational health and safety as well as health promotion. A lot of flexibility in the program, fresh ideas constantly being inserted, and most importantly, fun. People, everyone we witnessed in classes or in gyms or any of these programs really seem to be enjoying themselves and enjoying the people surrounding them in doing things that are a lot of fun. In fact, at Next Jump, we were walking into one of their classes, which was teaching the employees, including senior management, new dance routines, and that looked like a lot of fun. Finally, measurement and evaluation, and of course, you never know whether the program is working or not unless you track and monitor over time. But it's important also up front and along the way to ask the question, what do we mean when we say this program works? Because different people from different backgrounds are going to tell you different things. They're going to say, well, I want to make workers aware of their health and how to improve their quality of life, participation, engagement, lose weight, stop smoking, exercise more, medical claims should go down, absenteeism, attract talent, and so forth. So there are a lot of different potential goals, and you really ought to listen to and understand what those aims are, what the purposes are, how those align with the organizational mission, and then importantly, how to set up measures and metrics to record those kinds of outcomes when they occur. Also, as I said, we asked people what didn't work, and here are some things that we've learned over time of things that really do not work, do not constitute effective comprehensive health promotion programs. HRAs alone don't work. Health outcome incentive-based models that are disconnected from a comprehensive health promotion program, they don't work. Under the radar stuff usually provided by a health plan with very low participation doesn't work. Short-term campaigns like Biggest Loser really are not very effective, and they may even be harmful. Asking your vendor to fix the unhealthy people without having any skin in the game, not a good idea. A lot of biometric testing, but nothing else. And then poor marketing communication with no customer input, just kind of, just the standard marketing campaign, but not really listening to your audience and asking the question, what's going to make a difference to you? What kind of message is going to gel and be something that you pay attention to? So the bottom line is, back to idea number 1, which is culture of health, which then reinforces the idea of a value on investment. So not just a return on investment in monetary terms, but much more focus on the value that this program offers us. And so these are some of the quotes that we heard from senior managers as we went around the country. It's the right thing to do. Not everything has to have an ROI. Our people and their unique individual talents are valued, are valued. Happy people, healthy people, present, engaged, energized, active, productive, satisfied, low turnover. People really want to work here. Win as a team, lose as a team. It's who we are. And this is a poster taken from Next Jump, our why. Do the little things that allow others to do the great things that they are meant to do. That's kind of their mission, but it really does capture the idea of we really value you as a healthy and productive employee. So to finish up, workplace health promotion programs work if you do it right. And there's lots of evidence out there, lots of data showing that you can have positive financial outcomes from these programs, direct costs, medical costs, but also indirect costs and absenteeism, disability, safety, workers' comp, presenteeism. You need to couple that with health outcomes, adherence to evidence-based medicine, behavior change, risk reduction, health improvement. But then on the right side, the humanistic outcomes that are becoming much more important in these kinds of programs. Improvement in the quality of life of workers, enhancing their performance and productivity, their well-being, their functioning, attracting and retaining the best workers, being the employer of choice in a community, engaging people in their work and with one another, this being part of a balanced scorecard and part of their corporate social responsibility obligation. So to finish up, I think the old paradigm that we've had for many, many years is that this is how health promotion works. You've got a bad behavior, I just told you, that's going to lead to a high-risk condition like obesity. That leads to a disease like diabetes, and because of that, you're going to die. You're going to die early. So change because I tell you to do that. And I don't think that's a very positive, reinforcing message. The new paradigm, and the one that we're hearing more and more of, is that good health is really much more broadly defined. Physical health, mental health, emotional health, social health, intellectual health, financial health, even spiritual health. And by spiritual health, it goes back to this whole idea of your personal mission, your purpose in life, and how does good health help you achieve that mission and purpose. So if you're looking at that, that leads to well-being and high energy, and that leads to a purposeful life and high value for the organization and for you, and those two things have to be aligned. So this is our website. For those of you interested in reading these stories, we've got a lot of blog posts, and they're written in journalistic style. So they're not academic treatises. They're really meant to be digestible, short and sweet narratives describing our travels through various companies and also things that we've learned, themes that we've picked up. It's promoting healthy workplaces. It can be found on our Johns Hopkins website. And with that, I want to thank you, and we'll open it up for questions and comments. Thank you.
Thanks, Ron. That was great. Yeah, please type your questions in, and we will get through as many of them as we can. Yeah, anyway, sorry. I just was distracted because Bill, who is so quick on the draw, it's unbelievable, already has a question. He says, the secret sauce is not so secret. Unfortunately, I would agree with him, but there's a lot of people who wouldn't. They've all been around for years. So why are so many programs being run and or created today that are not well designed, well implemented, well funded, so on and so forth? So how can we, I guess his question really is, how can we get this message to health promotion, health professionals that are already out there who've been doing what they've been doing and not maybe getting the results they would like to date?
All right, so this is actually the crux of the purpose of our project, which is to get the word out to audiences that normally don't hear this kind of information, and that's the business community. So our target audience, and if anybody on the call could help us on this, our target audience is readers of the Wall Street Journal and Business Week and Fortune Magazine and New York Times and the periodicals that are directed at the business community to get some of this information out, best practices and the secret sauce. Yeah, we kind of know the secret sauce, we the insiders, the professionals, but the business community really doesn't. And they often see wellness in a very unidimensional point of view, and it's often distorted by some of the bad press media that's out there that basically is focusing on incentive programs, and that's it. And that's what they call a health promotion or a wellness program. So our job is to enlarge the definition and discussion of what constitutes a best practice workplace health promotion program, and get this information out to the business leaders out there so they can implement good programs, not bad programs.
Excellent. Much way better said than I was trying to summarize Bill's question. Okay, here's a question from Janetta. She's saying that she's struggling with middle management to get them to buy into the wellness program. How to engage them?
Well, I mean, some of the tricks that I mentioned is have it as part of their performance criteria. So when they do an annual performance review, that ought to be one of the elements that they're being evaluated on, the extent to which they provide a healthy culture for their workers and the kinds of things that they're doing to improve the health and well-being of the workforce. And obviously that can be very broadly defined. We're not just talking about lowering blood pressure, but also having positive morale, good work relations, people are supportive of one another, a trusted environment, a non-hostile environment. All those things can be included and embedded in performance reviews. And that's where you basically begin to identify those leaders, those middle managers that are the ones you want versus the ones that really are not doing a whole lot to improve morale and productivity and performance of the workforce.
Yeah, she said top management won't support that. So that is a tough situation.
Mm-hmm.
So maybe just ongoing, walk with them, let them come to that.
Well, also, offer these programs to them so that they experience these programs firsthand instead of just reading about them.
That's a really good point. Here's somebody. Let's see. This is Tori in a fairly unique situation. In any multi-employer trade worker union wellness program, words of wisdom. How best to promote wellness How best to promote wellness to this unique population, resources for best practices.
Right. Actually, we published a study about a year or so ago. We worked with 121 employers in Colorado, many of them small businesses, sometimes one or two employees, many in construction and public sector. We worked with a company called Pinnacle that offered this health promotion program to its stakeholders, its members, its customers. So Pinnacle is actually a workers' comp company. They decided that would be a really good idea to provide health risk management or health promotion program to their customers. And so the companies all got together. They got a common program with a common health assessment and common deliverables and a whole bunch of things. And they also pooled all their data together so that they were able to track changes in the health risk profile of the population and also do an ROI analysis with a combined data set. So 121 companies, and in pooling all their data, they came up with several thousands of employees that they could track and monitor. So that's one example of a consortium coalition coming together. But we're now beginning to work with unions. We're beginning to work with 1199 SEIU and helping them come up with some ideas, especially starting with the healthy company culture notion, kind of making sure that the environment, the ecology, the infrastructure, the foundation for the organization is healthy, and then providing individual services to employees so that they can benefit. But that's an example of kind of a union or a trust getting together and saying this is going to be good for our membership to keep them healthy and productive.
Great. Well, here's not really a question from Nico, but I guess a thank you to Ron, or to you, Ron, for addressing what is a successful program. So much in the media still relates success to ROI, and if we did that as it relates to healthcare and all the money that is spent there without an ROI, maybe we would reframe that somehow.
No, it's a good point. I make it all the time. When you go in to have a procedure done, surgery or even taking medication or whatever, you never really expect an ROI from that. You don't expect a rebate check to appear in the mail, giving you money back because you had that procedure done. It's a service. Healthcare is a service. right now in the United States is still pretty much an inefficient service. And the amount that's being spent on prevention and health promotion, worksite and otherwise, it's a tiny fraction of that entire bill, 5% at most. So most of the money is being spent on treating diseases, and there is no ROI, with some very rare exceptions in preventive services. But most of what we pay for in terms of disease treatment is a cost. It's not a benefit.
Exactly. Yeah. So he said, following up, city spent $1 billion on healthcare, CITI. So money spent on wellness is well spent. Excellent point.
Okay, that's Eco from Citibank. Great.
Yep. Let's see. Question from Ontario. Have you been involved in any of the research where employers were offered seed funding as a carrot to initiate the conversation about workplace wellness?
Yeah, there are some state programs out there where the state health department has given some seed money to involve and engage workers. And I know CDC has done nationwide demonstrations, the National Healthy Workforce Project and a few others where companies were not, they were given support and technical assistance and some services. And I think even in some cases, actually the state of Massachusetts, I believe, has a program which provides tax credits to companies that have health promotion programs in place. So there are some examples of that. But quite honestly, I think the expectation of government, and it's not an unreasonable expectation, is that private business ought to fund it itself, because they're enterprises with the intent of making money. And if they do it right, they certainly will not lose money. They'll probably break even if they have good, robust programs, and they may even make money. But certainly they can gain in other ways in terms of attraction, retention of talent, and being the employer of choice that is offering these great programs.
Yeah, I think I agree with you. I'm familiar with some of the CDC demonstration projects to which you refer. And I think as long as the bottom line is ROI, if that's the only measure, then you will never be successful. I think if the topic is about money, it's always going to be about money. And really, as you said, the preferred place to work, the aid in retaining and attracting a better employee, certainly does have its own intrinsic value. Let's see. Bill says that Maine has a small employer, 20 or less, with a tax credit. I think Kentucky had one at one point, but I think maybe it's expired. And I think maybe Indiana was looking at one. So I think that question was from Canada, but there probably are several examples around the U.S. of tax credits. So other questions? Anybody? You've got 3 minutes. But I think this is, we have had questions about, will the slides be available? And I assume you probably sent them to Kelly. Is that true?
Yep, she's got them.
Okay, cool. Then they'll be available on HP Live, which is great. Thanks, Kelly.
Yep. If you check the chat, it should be out there. I put the link in the chat. So in the next 3 minutes, if you look that up, it should be there.
Oh, super.
And you'll get it in an email too.
Okay. Awesome. Well, I think this was really good, Ron, and I'm really looking forward to learning more as this continues.
Yeah, and I think I mentioned earlier that we're going to be continuing this process of disseminating ideas and best practices, with Robert Wood Johnson Foundation. But we also have a number of other projects, some of which are federally funded, some are foundation funded, to get these kind of employer guides in the hands of businesses, small and large, so that they can do these things on their own and don't have to depend upon the academic research to help them figure out how to do things. So much more direct, straightforward, here's how you do this, try it out, see if it works. Something employers have been asking for quite a bit.
Yeah, it can be hard to know. Certainly with the internet, there's no shortage of information, but being able to determine what is actually good information and not just a sales pitch can be a challenge. So Thank you so much, Ron. Great spending time with you as always. And as I said before we started today, the door is always open, so please keep us updated on what you're up to.
All right, will do. And thanks so much for organizing and for everyone for attending. Thanks so much. Have a great weekend, everybody.
Thanks. You too. Take care, everybody.
All
See
right.
you soon. Bye-bye.